Right now, I want you to pay very close attention to something most people completely ignore while they sleep, because it might be quietly affecting your brain and heart without you even realizing it. There is a specific sleeping position that, in certain individuals, may increase strain on circulation during the night. And over time, this is something I've seen overlooked far too often in patients who later experience serious cardiovascular issues. Before we go deeper into this, if you care about your health even a little, and I believe you do, take a second right now to like this video and subscribe. Not for me, but because what you're about to learn could genuinely help you become more aware of what your body is telling you every night. Now, I'm Dr. Sarah, and I've spent years working with patients who thought they were completely healthy until subtle warning signs started showing up. Most people don't realize that the way you sleep is not just about comfort. It can influence breathing patterns, blood flow, and even oxygen levels in the brain in sensitive individuals. What I'm about to tell you might surprise you. There is a commonly used sleeping position that, for some people, especially those with high blood pressure, diabetes, or existing vascular concerns, may place extra pressure on circulation pathways. And while it doesn't directly cause a stroke, research suggests it may contribute to conditions that increase risk over time. I've seen this happen too many times. A patient comes in complaining of morning headaches, dizziness, or numbness in the arms, brushing it off as just aging or bad sleep. But when we dig deeper, their nighttime habits often tell a much bigger story. So tonight, as you listen, don't just think of this as general information. Think of it as a quiet conversation about your body that you may have never had before. Because sometimes, the smallest habits repeated over years become the most important health clues we ever receive. Let's go deeper into what actually happens in your body when you sleep in certain positions and why your brain and heart may be more sensitive at night than you think. When you fall asleep, your body doesn't simply shut down. Instead, it shifts into a delicate recovery mode where your heart rate slows, blood pressure naturally dips, and your brain relies on steady oxygen supply to maintain healthy function through the night. This is exactly why sleep is so powerful for healing, but also why small disruptions can matter more than most people realize. One of the most discussed concerns in sleep medicine involves prolonged pressure on the neck and blood vessels. In certain sleeping positions, especially those that involve twisting the neck or compressing one side of the body for hours, blood flow dynamics can subtly change. For most healthy individuals, the body compensates easily, but for people with underlying conditions like hypertension, diabetes, or arterial stiffness, that compensation may not be as smooth. What I want you to understand is this. We are not talking about immediate danger. We are talking about long-term strain that over years may contribute to vascular stress, and that is where awareness becomes important. Side sleeping, for example, is often recommended for digestion and snoring. But if your head is not properly supported, or if your neck is sharply angled, it may place tension on the cervical spine and surrounding blood vessels. On the other hand, sleeping flat on your back can be beneficial for spinal alignment, but in some people, it may worsen breathing issues such as sleep apnea, which is itself a known risk factor for cardiovascular disease. This is why there is no perfect position for everyone. Your body tells a story based on your health history, age, and circulation patterns. I've had patients who were surprised to learn that their morning fatigue, blurred thinking, or even mild tingling in the hands was connected not to stress alone, but to nightly posture habits they never questioned. And here is the part most people overlook. Sleep positions don't just affect how you feel in the morning. They influence how your cardiovascular system recovers overnight, when it is supposed to be at its most stable and protected state. So the question is not just, how do you sleep? But how does your body respond while you are asleep? Let's continue, because there is a specific position that is often misunderstood, and it deserves a closer, more careful look. One of the most commonly debated sleeping positions in cardiovascular health discussions is sleeping on your stomach. Many people prefer it because it feels comforting, almost grounding. But from a medical perspective, this position can place unique stress on the neck and upper spine, especially when maintained for several hours. When you sleep on your stomach, your head is usually turned to one side. Imagine holding your neck in a rotated position for 6 to 8 hours without release. Over time, this can create tension in the cervical region, where several important blood vessels travel toward the brain. While healthy individuals typically tolerate this without major issues, in people with pre-existing vascular sensitivity, it may contribute to reduced comfort and subtle circulation changes. Now, I want to be very clear. This does not mean stomach sleeping directly causes stroke. That would be medically inaccurate and unnecessarily alarming. Instead, what we are discussing is how certain positions may interact with existing risk factors in a way that is not always visible in daily life. Most people don't realize that the brain is extremely sensitive to oxygen and blood flow changes, even minor ones. When circulation is slightly restricted or altered repeatedly over time, the body adapts. But that adaptation is not always ideal for long-term vascular health. I've seen patients with recurring neck stiffness, morning headaches, and unexplained fatigue who never connected their symptoms to sleep posture. And once we adjusted their sleeping habits, many reported noticeable improvements in how they felt upon waking. There is also another layer to consider: breathing quality. In stomach sleeping, the chest may be partially compressed, which can make deep, relaxed breathing more difficult for some individuals. Over time, shallow breathing patterns at night can contribute to less restorative sleep. Still, it's important not to create unnecessary fear. The human body is resilient. Occasional stomach sleeping is not dangerous for most people. The concern arises when a single position is used every night, year after year, without awareness of its potential impact on an individual's health profile. So rather than labeling positions as good or bad, I encourage you to think in terms of balance, support, and awareness. Your sleep posture should help your body recover, not work against it silently. And now, let's move into something even more important: how your circulation behaves differently depending on what happens while you are completely still at night. At night, when you are completely still, your circulatory system becomes more dependent on external conditions than during the day. During waking hours, movement helps blood circulate efficiently. But during sleep, especially long, uninterrupted sleep cycles, posture becomes one of the primary influences on blood flow patterns. This is where things become particularly interesting from a medical standpoint. In some individuals, especially older adults or those with metabolic conditions like diabetes, blood vessels may already be less flexible than in younger years. This reduced elasticity means circulation can be more sensitive to pressure or positioning. Now, imagine maintaining one position for several hours. Even small points of pressure, such as the shoulder, neck, or jaw alignment, can subtly influence how blood returns from the brain and how it flows through the neck arteries. Again, this is not about sudden blockage. It is about gradual strain patterns that may contribute to discomfort or vascular stress in susceptible individuals. Most people don't realize that symptoms like waking up with a dry mouth, mild dizziness, or a heavy sensation in the head are sometimes not random. They can reflect how your body is managing overnight oxygen balance and circulation. In clinical practice, I often ask patients about their sleep habits, not because I expect a single answer to explain everything, but because sleep is where many hidden patterns reveal themselves first. There is also an important connection between sleep posture and blood pressure regulation. Normally, blood pressure dips during sleep, giving the cardiovascular system a chance to rest. But if sleep is fragmented or physically uncomfortable due to positioning, this natural dip may not occur as effectively. Over time, this can place additional workload on the heart. However, I want to emphasize something very important here. Awareness is the goal, not fear. Your body is not fragile. it is adaptive. Small changes in sleep environment, like pillow support, mattress firmness, or gentle position adjustments, can often make a meaningful difference. I've had patients who felt dramatic improvement simply by supporting their neck more properly or avoiding extreme twisting of the head during sleep. So rather than focusing on a single dangerous position, think about whether your current sleep setup truly allows your body to relax fully, or whether it is quietly forcing compensation all night long. And now, let's talk about something that connects all of this together: the hidden relationship between sleep quality, brain health, and long-term vascular protection. Your brain is one of the most oxygen-sensitive organs in your body. Even slight changes in oxygen delivery or blood flow during sleep can influence how refreshed or fatigued you feel the next day. This is why sleep quality is not just about duration. It is about how efficiently your brain is supported throughout the night. When circulation is stable and breathing is deep and regular, the brain undergoes important repair processes. Waste products are cleared, neural connections are strengthened, and memory consolidation occurs. But when sleep is disrupted, whether by posture, breathing difficulty, or repeated micro-awakenings, these processes may become less efficient. Now, here is something many people don't connect. Sleep posture can indirectly influence breathing patterns. For example, certain positions may encourage partial airway narrowing in susceptible individuals, especially those with snoring or mild sleep apnea. When breathing becomes slightly restricted, even without full awakening, oxygen levels may fluctuate in small but repeated cycles throughout the night. Over time, these fluctuations can place stress on the cardiovascular system. I want to be very responsible here. This is not meant to alarm you into thinking your sleep position is harming you every night. Instead, it is about understanding how interconnected your systems truly are: breathing, circulation, posture, and brain function all working together while you rest. Most people don't realize that improving sleep posture alone can sometimes reduce morning fatigue, improve concentration, and even support more stable blood pressure readings in some cases. I've seen individuals who struggled for years with unexplained tiredness only discover that their pillow height or sleeping angle was contributing to poor sleep quality. Small adjustments led to surprisingly noticeable improvements. The key message here is not perfection, but awareness. Your body communicates through subtle signs. Morning headaches, neck stiffness, or restless sleep are not just inconveniences, they are feedback. And when we listen to that feedback early, we often have more control over long-term health outcomes than we realize. So as we continue, I want to shift your attention toward practical awareness, how you can start recognizing whether your sleep position is supporting your health or quietly working against it. Now that we understand how sleep posture interacts with circulation and breathing, the next step is learning how to recognize whether your body is actually responding well to how you sleep each night. One of the simplest indicators is how you feel immediately upon waking. Your body should ideally transition from sleep to wakefulness smoothly. If you consistently wake up feeling stiff, unusually tired, or mentally foggy, this is not something to ignore or normalize as just aging. It may be your body signaling that recovery during sleep was not optimal. Another subtle sign is the presence of recurring tension in the neck or shoulders. When a specific sleeping position is not well supported, muscles may remain partially engaged throughout the night instead of fully relaxing. Over time, this can lead to chronic tightness that many people assume is unrelated to sleep. There is also the matter of breathing awareness. If you wake up frequently during the night, snore heavily, or experience dry mouth in the morning, these can sometimes be linked to how your airway is positioned during sleep. Again, this does not automatically indicate a serious condition, but it is worth paying attention to. I often remind my patients that prevention is not about dramatic change. It is about small, consistent improvements. Something as simple as adjusting pillow height so your neck remains aligned with your spine can reduce unnecessary strain. Similarly, avoiding extreme rotation of the head during sleep can support more natural blood flow patterns. What I find most important to emphasize is this: your sleep should not require effort from your body. You should not be holding a position all night. You should be resting into it. Most people don't realize that their mattress, pillow, and habitual position work together as a system. If one element is misaligned, the entire system can become slightly inefficient over time. And while none of these factors alone determine serious outcomes like stroke risk, they can contribute to your overall vascular and neurological health when combined with other risk factors like blood pressure, cholesterol, and lifestyle habits. So instead of thinking in extremes, think in patterns. Your nightly habits are part of a long-term health equation. And in the final part, I want to bring everything together so you can walk away with clarity, not fear, and a better understanding of what truly matters for protecting your brain and heart health over time. As we bring everything together, I want you to remember one simple truth. Your body is constantly communicating with you, even while you sleep. The way you position yourself at night is not just a habit. It is part of your long-term health environment. We explored how certain sleeping positions, particularly when combined with existing health conditions like high blood pressure, diabetes, or sleep apnea, may place subtle stress on circulation and breathing patterns. But we also made something very clear. There is no single sleeping position that directly causes stroke in healthy individuals. That would be an oversimplification of a much more complex system. What matters most is consistency, support, and awareness of how your body responds over time. I've seen too many people overlook early signs, morning fatigue, neck stiffness, restless sleep, assuming they are normal parts of aging. But often, these are early signals that your sleep environment could be improved. The good news is that small, realistic changes can make a meaningful difference. Better pillow alignment, mindful sleeping posture, and addressing underlying conditions like blood pressure or breathing issues can all work together to support healthier sleep. What I hope you take away from this is not worry, but empowerment. You don't need to fear sleep. You need to understand it. Because sleep is not just rest. It is one of the most important biological repair processes your body has every single day. And when it is supported properly, it becomes one of your strongest tools for long-term health. If this information helped you become more aware of your own habits, take a moment to like this video and subscribe, not just for support, but so you continue receiving guidance that helps you make informed decisions about your health. And as always, if you are experiencing persistent symptoms like dizziness, headaches, or unusual fatigue, it is important to consult a qualified healthcare professional for personalized evaluation. Take care of your sleep, and your sleep will take care of you.